Welcome to the Inspire and Ignite series with Safe States Alliance. Each month, we bring you a two-part series focused on innovations in injury and violence prevention. At the beginning of the month, we release a pre-recorded webinar you can watch at any time. Later in the month, we host a facilitated conversation for practitioners to come together and brainstorm opportunities to strengthen the field. For more information about this series this month, use the QR codes at the end of the video. Thanks for watching.
Hello, and thanks to Safe States for letting us talk a little bit about research on drowning. Today we're going to talk about highlighting the interconnectivity of community practice and research in drowning prevention. So I'm Dr. Molly Johnson. I'm the research scientist at Dell Children's Medical Center in Austin, Texas. Together, the two of us presenting today make up the Drowning Prevention and Water Safety Program. Barbara?
I'm Barbara Cozart, and I am the Injury Prevention Coordinator for the Drowning Prevention Program. It's great to be here.
So first off, I just wanted to shout out to the public health approach. Helps us sort of put what we're talking about in perspective. And so as we go through the presentation, we'll kind of highlight the different aspects of the work that we're doing or hope to do in the future and how it might be helping to define and monitor the problem, maybe identify risk and protective factors, develop and test prevention strategies, and eventually assure widespread adoption as we go forward. So just a bit of background about drowning. In the United States, there are at least 4,000 drowning deaths every year. In Texas, where we're based, about one person fatally drowns every day. We also have the third highest number of drownings of all states. So it's an issue near and dear to our hearts in Texas, but similarly across the country. Drowning isn't always fatal, though. According to the World Health Organization, we have to be clear in how we talk about drowning, in that there is fatal drowning, and then there is also non-fatal drowning, where somebody might survive a drowning incident. In many cases, they might then have long-term neurological or psychological or functional issues as a result of that drowning injury. There are certain people who are at higher risk of drowning. Research shows that across the US and worldwide, males are at a higher risk of drowning. In the US, Black or African Americans and Native Americans have also been found to be at a higher risk of drowning than other races. As far as age goes, for toddlers, for children 1 to 4 years old, drowning is the leading cause of death. It remains a leading cause of death for children up to 14 years of age. But drowning also impacts people of all ages. Different age groups, though, have different circumstances that they tend to drown in. The setting where people drown varies by age, in that teens and adults tend to drown more likely in natural water. For children 5 years and older, they drown in swimming pools, but also in natural water. And children 1 to 4 years old are more likely to drown in a swimming pool. For infants up to 1 year old, the setting that is higher risk for drowning is a bathtub. So for the first couple studies that we're going to look at, we're going to focus in on these younger age groups. looking at bathtub drowning and then a certain type of drowning situation that is pretty common for younger children. So some work that we did at our hospital involved reviewing the medical records of the children who were treated for drowning at our pediatric hospital. We looked at records over a 10-year period. For one study, we were interested in knowing about the drownings that occurred in a bathtub. We saw that of the 457 patients that were treated for unintentional drowning over those 10 years, 50 of them, or 11% of the patients, the pediatric patients treated at our hospital, that drowning occurred in a bathtub. So when we looked at those patients, we saw that most of them were very young. 56% were under 1 year old, 84% of them were under 2 years old. We found that for some of those young patients, but particularly for most of the older children that presented at our hospital for a bathtub drowning, a seizure was a driving factor. But for many of the children, especially the younger children in our cohort, lapses in supervision were a driving factor. We found that when there was a lapse in supervision, the drowning injury was more severe. More of the children who didn't have a supervisor present had to be admitted to the hospital, whereas those who were supervised were more likely to be treated in the emergency department and then discharged without being admitted to the hospital. The lapses in supervision had a number of different activities that the caregiver was involved in, but the most common thing that a caregiver was doing when they left the bathroom with a small child in the tub was that they were retrieving towels and or clothes. So they were doing a chore that was related to that bathtub time. And over half of the activities that we considered lapses in supervision involved retrieving a towel or clothes. So we find this a really useful result coming out of this research, in that there is a takeaway that hopefully drowning prevention coordinators can use as far as guiding parents to gather towels and bath supplies before putting a child in the water. And we hope that in some next steps that we are involved in, that we can use this information to create a bath safety box, maybe develop a towel that has some messaging on it that can really highlight the need for parents to take this one very critical tip to heart. So a second study that we did over the same time period with the medical records of the children that were treated for drowning at our hospital was to look at the drownings that occurred during recreational water time. So when the family, the child, was planning to be around water. And we looked at the set of patients that they were supposed to be around water, but were not supposed to be in water at that moment. And we called that a transition point, this time point during planned recreation water time when a child is not supposed to be in the water. So you're at the pool, maybe you're on a lunch break. And so of our patients at the hospital, we had 294 patients who were out for recreational water time. 21% of those patients, the drowning incident occurred during this transition point, during this time when they were actually not supposed to be in the water at that moment. The activity that that child was involved in, or the family was involved in, when that transition point drowning occurred varied a bit. Almost half of them were when they were packing up and preparing to leave. But many of the other transition point drownings occurred during other time points, such as arriving, taking a bathroom break, or taking a break to eat or prepare food. When we looked at these transition point drownings, we found that the children who experienced them were younger than the children who experienced drowning that did not occur during a transition point. They were 3.3 years on average compared to 4.8 years for the non-transition point drownings. We also found that those who experienced a drowning during a transition point, the drowning injury was more severe. They were more likely to not be breathing, more likely to be unconscious when they were retrieved from the water. They were also more likely to be admitted to the hospital than the children who drowned at a time that was not a transition point. We also saw some differences in where the drownings occurred between transition point drownings and those that did not happen during a transition point. If it was during a transition point, almost all of them occurred at a swimming pool. For those not occurring during a transition point, still most of them were at a swimming pool, but fewer at 79% compared to the 97% for transition points. We also found that the location of the water varied a bit, in that transition point drownings were more likely to occur in water that was at a single family home or at a community center, whereas the non-transition point drownings were more likely to occur in a public area like a public pool. That made us wonder if there was something about the familiarity of home settings that meant that transition point drownings might be a little bit more likely. We did a qualitative analysis of some of the themes that came out of the circumstances of the drownings that occurred just for those patients who drowned during a transition point. And we found that it was common for the child to get in the water without their life jacket on when the parent was planning to put it on, or to get in the water when they had been wearing their life jacket but was taken off either for a break or because they were preparing to leave. So there was sort of a what we considered a delayed application or early removal of the flotation device for these children. We also saw some common situations where there were situational themes with supervision. Maybe a grandparent or a relative or a friend was the caregiver instead of the parent. Maybe the caregiver was talking or distracted at the time that the drowning occurred. Other common situations were that that caregiver was gathering supplies or caring for other children. We also found that the caregivers had expectations for these children. Again, 3-year-old children was that median age for the transition point drownings. The parents tended to expect that they could tell that toddler to stay out of the water and that they would then just stay out of the water. So some what we consider relatively high expectations for very young children as far as following instructions like that. The parents also had expectations about the possibility of drowning. A number of them mentioned that there was only shallow water nearby, so it had not occurred to them that there was any risk of drowning in that situation. So their expectations of what type of water settings would or would not put their child at risk were not really in line with the actual risk of any depth of water, say. We also found that there were some situational factors that were common, gatherings like pool parties or traveling where the family was at a hotel or at an Airbnb where they were unfamiliar with the situation. So these results highlight how it is important for us to bring awareness to the public about the risks of drowning during transition points. We tend to think of needing to watch children when they are in the water, but in fact, there is a high risk and a risk that is associated with higher injury severity for children who are drowning when they are near water, but not supposed to be in it at that time. We also need to consider ramifications for flotation device use, in that this research highlights a need if a child is going to be wearing a life jacket, that the parent consider maybe putting that life jacket on when they arrive at the pool and take it off only as they are leaving the water area, and be mindful of what their actions are around flotation devices during breaks, with that understanding that when a life jacket is commonly on a child, they may not understand the difference between having a life jacket on and off if they are to get back in the pool without the parent noticing. We have to really be aware that we can't ask children to keep themselves safe around water, that's not a reasonable expectation for toddlers. And that, of course, providing close, constant, attentive supervision anytime we are around water is one of the most important layers of protection. We also have to be sure that caregivers are capable, in that they are knowledgeable about water safety, that they might be capable of a quick retrieval if a small child were to get back in the water as they were packing up to go or something like that. We also think that this research highlights the need to have a water watcher, and especially during gatherings and pool parties, and a water watcher that is aware that their duty to watch the water doesn't stop even if there is no child in the water at a given moment in time. That those times when children are in the water or supposed to be out of the water are equally important for monitoring pools. So this research, we think, fits well within the health belief model, in that if we can make some behavioral changes in how we are around water, we can hopefully work to reduce drowning risk. With the bathtub drowning research that we presented, thinking of bringing in a cue to action, such as a towel that has messaging on it, and visual cues that would remind parents to go get their supplies before putting a child in water. With this transition point drowning research, maybe we can help shape perceived norms, such as encouraging the common practice of using water watcher tags. We also think that there might be some link between this transition point drowning and some of our additional work that Barbara is going to talk about in a moment, in that autistic children might be at an increased risk of drowning during transition points. We'd be interested in looking into that. Elopement as a common issue for children with autism, they might just be more likely to return to water without a parent being knowledgeable about it. So a future direction for us to look into. And I am going to hand it over to Barbara for the next half of the presentation.
Okay, thank you, Molly. If you don't mind, just advance the slides as I conclude each talking about each slide. So, as we know, drowning is the leading cause of death for children with autism through age 14. they are 2 to 3 times more likely to drown than non-autistic children. And in fact, this may be an underestimate due to the limitations of the data that we have to work with. Um, at this time, it's estimated that 1 in 30 kids are diagnosed with autism. And although diagnosis is happening earlier now than in previous years, it's the average diagnosis age is around 3 years. The risk of drowning exists before the diagnosis happens. So we also need to be familiar with characteristics of autism in very young children, including anyone who works with children or teaches children, such as swim instructors. Next slide. And so in order to understand this risk and identify potential solutions, we devised a qualitative study to gauge perspectives of parents of autistic children, as well as swim instructors who work with them. And in this process, we identified many risk factors and protective factors. Next slide. So the first theme that we identified by talking with several parents of children on the autism spectrum. These were children of a variety of ages. Characteristics of their children's autism really influence their water safety risk. For example, the children with autism often have a poor sense of danger or the ability to assess risk. About half of all children with autism have the tendency to elope, and that's something that parents frequently brought up during the focus groups. And many of them mentioned the common characteristic that their children have a magnetic attraction to water. One parent discussed this inner conflict that she had. She says she wants to nurture that confidence and her son's independence, but he doesn't understand yet why something is inherently dangerous. And another parent pointed out her daughter has a deep and abiding fascination with deep water. Okay. And the next theme that we identified was that fears around water safety can profoundly influence family life and what families do. Many of them pointed out that they avoid water, different types of bodies of water, going to certain places for fear of water safety issues coming up. This can affect travel plans, where they go, who they visit. One parent pointed out she doesn't really go to her brother's house. They leave the gate open. They can tell their kids, don't go in there, stay out of the pool area. But with her son, it just does not work that way. And the third major theme was that water safety and swimming lesson information for autistic children and their families is very difficult to find or access. So they're dealing with insufficient water safety information. Very few, it pointed out that they got any information from healthcare providers about water safety. There are competing priorities, many appointments, therapy sessions, other kids' activities. Their schedules are already very full. And then there's also a very limited availability of adaptive lessons. And many of them have tried conventional swim lessons, but have had negative experiences. And one parent said that a lot of the lessons are designed for half an hour because that's how much stamina the kids have. But almost in our case, our kid, he takes 20 minutes to warm up to getting into the pool. So you get a 10-minute lesson. So that's an example of the standard lesson that just, it may work for most kids, but with the transition difficulties of her child, it just did not yield a net benefit. And the fourth major theme was that characteristics of autism can affect participation in swim lessons and other aquatic activities. So, for example, we have sensory overload, especially in an enclosed area where there may be lots of echoes, lots of, chlorine smell, lots of chaos going on, depending on what other activities are happening there. Tactile challenges, the way things feel, particularly around, wearing a life jacket or maybe goggles, or even needing a certain kind of type of goggles that feel exactly the right way. Masking was a common issue. Masking is where the child expends a lot of energy trying to appear neurotypical. Many of the children struggled with self-awareness, for example, around how they're feeling, not really being able to detect when they're reaching a point of overload. Inflexibility, having to have things the same way, that can cause a lot of conflict. And there are other diagnoses like ADHD and other medical conditions that can interact with autistic characteristics to make participation in swim lessons very difficult. One parent said the sensory experience was completely overwhelming, and so he couldn't even finish the first lesson. And that was a common theme that was pointed out. The fifth major theme we identified was that autistic children have unique swimming lesson needs. So they will have specific communication and learning challenges, and this is going to vary from child to child. It's beneficial to have a dedicated environment, for example, a space where there's not a lot else going on, other types of classes, a lot of other children, a lot of other noise happening. And parent involvement is very important. And as one parent put it, she says, "I think we need a swimming context that is centered around the needs of the neurodivergent, and then everybody else can meet you where you are." So lastly, the sixth major theme was that instructor preparedness is key to swimming lesson success for autistic children. So this came up, the need for experience, not just any experience, but hands-on experience with autistic individuals, where they really understand, and not just have knowledge of what it is and looks like, but have interacted in a meaningful way with autistic students. As one parent put it, she phrased it as therapist skills, so the same kind of communication aptitude as like their behavioral therapist might have. Another mom put it this way: they need people who are deeply autism aware, one-to-one communication skills, that person who understands how instruction has to happen and how much time it takes. That it came up over and over again, like the swimming lessons for their children did not happen on the scheduled timeline for regular swim instruction. Okay, next slide. And so the next phase of our study was talking to the swim instructors. So we had several swim instructors in the Austin area. And we had two focus groups and a couple of individual interviews, and we came up with 3 major themes. You can go ahead and advance to the next slide. The first major theme was, and a lot of this is going to echo what the parents pointed out, unsurprisingly, The swim lesson environment is very important. So theme 1 was swim school accommodations for autistic children. And this is going to include the swimming lesson environment as being very important to the success of the lessons. The structure of the swimming lessons. It may need to be different from your typical structure of swim lessons. The cost of adaptive swimming lessons. Now, it can be costly for parents, on the family side, if they need to seek adaptive or one-to-one lessons, but there is a cost to swim schools as well, which may limit their ability to offer them. They need to block out certain times and spaces. And it can be challenging to hire and retain skilled instructors. So one swim instructor, a manager actually pointed out, there are so many diverse needs when it comes to this community, and sometimes that would require quiet time, and your facility may not have the ability to do that. You start getting into this business concept of if you can even offer it, or if you can, do we have enough people signing up for it to make it actually a break-even cost? The next major theme we identified was the need for swimming instructor access to specialized training. So there's definitely a need for more specialized training. It exists. It's difficult to access. There's just not enough. There's a need for more education about autism in general. And as the parents pointed out, direct experience with autistic children in a supported way, and ongoing support for instructors as they learn and navigate this field. One instructor pointed out you need to have a strong understanding of the core symptoms of autism. And another pointed out the problem is that they're being labeled at my jobs as the problem child instead of getting the help that they need. And another pointed out that what they need, in addition to the training, is real-time support on the deck. The third major theme was teaching approaches and lesson structures. So there are a few components to this. Scheduling and structuring orientations and first lessons is really key. It's so important to get to know the child and have that direct communication with the parents, and go and meet the families where they are. Modes of communication, being able to know how you communicate with the child if they have specific communication needs, and being able to have flexible and structured lesson goals and plans. So structure is important, but it's also necessary to be able to pivot when needed. As one instructor pointed out, they really need time to develop a relationship and build rapport away from this kind of stressful environment of being around water. So, for example, that, with a kid who it comes to this scenario being afraid of water, perhaps because of a past negative experience, you need time to work up to that. Another instructor pointed out they need to be able to modify the curriculum to meet them where they are and break down skills as much as needed versus following a more systematic, streamlined curriculum. So again, regular curricula may or may not work depending on the child, but the need for flexibility is incredibly important. So next slide. So the next theme was that parent involvement is incredibly important. So most swim programs will have an intake form. This may require additional information, additional communication for kids on the spectrum. It can yield a lot of really helpful information for the swim instructor that they may or may not get otherwise. Also, teaching safety skills to parents is important, as well as teaching safety skills to the children, because the parents will take the information that's learned into their lifestyle and continue the lesson. And continuing communication with the parents, ongoing communication about mood changes, behavior changes, medication changes. These can all affect the ability of the child to do a lesson on a particular day. So that constant communication is really important. One of the instructors, as we were contemplating, thinking back to a difficult time, she said, thinking back to all the difficult times, having as much information about the child and about the special needs as possible would really solve any of the problems that she had that had come up. And another pointed out, I did not know that his medication had also been changed. And we were doing a typical thing, and all of a sudden the lesson went haywire. And so, future directions. So the next phase of our study is to take all this that we have learned from these two qualitative studies and have a survey that will go out to parents of autistic children nationwide. And this will help us to get kind of a wider view of what the needs are for autistic families. So there are still some gaps in our knowledge. For example, we would like to know where they would ideally receive information about water safety. Where can we reach them best? Where are they? Another gap is we don't know a lot about how rurality affects the ability to access water safety resources such as swim lessons, the time it takes for them to reach services, or whether these services even exist. And another thing that is needed is to include autistic voices. So speaking directly with autistic individuals about their needs and barriers around water safety. So bringing this research to practice. So as Molly mentioned before, health behavior theories and models can help us to understand where the challenges and gaps are that contribute to risk, and also help us to devise effective interventions to address them. So, for example, with the ecological model, we've got community level influences that can affect water safety. So, for example, are there adaptive lessons available in their community? And if not, what can we do to increase the availability? We've got, using the integrated theory of health behavior change, knowledge and goal setting is an important aspect of that. So, for example, one thing that is really cool, one of our capstone students was working on is developing a toolkit to facilitate medical provider and family conversations around water safety. And so using social cognitive theory, we can help improve self-efficacy. So, for example, improving supported learning for swim instructors, mentorship around working with individuals on the autism spectrum. And, that leads us to cool program that we had the pleasure of working with the Autism Society of America on. So they have developed the Water and Wandering program, and Katie Wentley from the Autism Society came and brought this training program to our area. We gathered up 8 swim instructors from the greater Austin area for a 2-day intensive training. And so part of this was in a classroom, part of this was part of the training was in water, including a lot of role playing. And then the coolest part of it, the second day, was having children with autism come with their families, and the children had a lesson with these instructors where they practiced their new skills that they learned in the training. And this was an amazing event. It proved extremely useful for the swim instructors. They felt much better about their skills, and families reported that their children did things that they didn't think they would do, like even getting in the water. This training included printed resources and water safety kits. The parents got some water safety kits, and the training actually includes a year's follow-up as they go through this year's swim season. They will get added support. And big shout out to a local swim school, Emler, who donated the space and the lifeguards. This was a wonderful partnership. And just a couple of quotes from the program. This was from a swim instructor. I've been working with the autistic community for years and still learned new things from the wonderful professionals in this training. And a parent said, I've seen my 12-year-old struggle with swimming in the past, but I've never seen him so calm and open to learning as he was during this swim instruction. It was such a positive change. And so we want to continue this. We want to assure widespread adoption of this wonderful intervention. We would like to expand the swimming instructor training opportunities, find ways to fund this in a scalable way, and perhaps turn it into a train the trainer model, which the Autism Society is already considering, so we can reach many more people and hopefully get farther into those rural areas as well. We want to be able to quantify the impact on the instructors and students and lessons taught. We are going to be administering some follow-up surveys, so we'll get some data in a few months from now. And there is an ongoing need for support for aquatic professionals as they teach autistic individuals, and we want to help foster that. So just to point out a few ongoing partnerships, we've got here in Texas, the Texas Water Safety Coalition, which consists of about 250 water safety stakeholders from a very wide variety of professions and fields. And we have all come together with the one common goal of helping Texans to be safer in, on, and around water and help to prevent drownings. And together we are developing the Texas Water Safety Strategy. More locally, we communicate with other coalitions such as the Safe Kids coalitions, businesses and organizations, local therapy providers and swim schools, and also working to get media coverage on these issues. I'll be working with Katie Wentley from the Autism Society to do a podcast on their program and how we implemented it here. We want to get the word out on social media and TV and other news coverage as well. Another other things that we are working on at the state and local level is really getting policymakers, industry leaders, insurance companies on board to help keep kids safer in the pool environment. For example, encouraging rebates for pool fencing. There is data to support this. Home pools are a very high risk environment for drowning. Autism data shows that kids are very attracted to water and have a strong tendency to elope, and so the pool environment is a high risk area, and we can do something about it. And so another thing is insurance companies, maybe flexible spending accounts, other healthcare funding accounts, making allowances for swim instruction, or providing vouchers or other reimbursements for kids with an autism diagnosis. And we know that children with autism have barriers to swim instruction because of limited availability, limited knowledge among swim instructors, and other barriers such as financial and distance. And also, we want to help foster building local and state regulations and enforcement of existing state regulations for retention and detention pond barriers. Unfortunately, retention and detention ponds are also a very high-risk environment. Kids with autism are very drawn to those as well. And unfortunately, there are just few or no regulations around enclosing those. And this is our list of references. Please reach out to us if you have any questions about this presentation, and we look forward to talking with you during our upcoming chat session.